Oh, shoot. Let's go. Okay, clap.
You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. Dudum. This is Back at It with Dr. Decompression.
Welcome back. This is the Back at It podcast with Dr. Decompression, episode 15. We're bringing it today. Today, we're going to talk about traction versus decompression. A lot of terms are thrown out there. What is traction? What's decompression? Let's talk about it. How are they similar and how are they different? What could be best for you? What have you tried? Let's break it down. Before we get into it, I want to thank our sponsors. I want to thank PillowWise, amazing pillows. If you haven't tried these pillows, you've got to give them a shot. Find a provider, talk to me, get measured. There's 6 different pillows. Amazing sleep. Number 2, I want to thank PowerPlate USA, our whole body vibration that we use to stabilize our patients with lower back and neck injuries. Their technology is absolutely amazing. Love the PowerPlate. Thank you to them. Let's dive into it. Let's break down traction and decompression. Traction here. Traction's defined as it's a pulling. It's a pulling of the spine. It's the act of being pulled. That's what traction is. Definition of traction. What's decompression? Decompression, on the other hand, is defined as the action of being pulled, or it's relieving stress. Relieving. Traction is the act of being pulled. Decompression is the release of pressure. Okay, you could see how they are different, but they're very similar as well. So let's talk about clinically, what are forms of traction? Traction historically has been done since the 1950s. Now we're in 2024, so 75 years or so, 74 years. Doctors were doing traction in the 50s when a patient would have sciatica, pain down their leg, radiculopathy, and they would strap them into some harness and they would pull them, and they would hold that pull and hope to relieve pressure. And it was very effective. Traction has been used for not only clinically for 74 years, but you can date traction centuries old where they found they pulled people and it helped, right? Because it's the act of being pulled. That's what it does. Other than 74 years ago, how was it done modernly? Well, you have manual traction. A physician can get behind your neck and manually pull, grab under your, sorry for our listeners, but for the viewers, you can grab under the occiput and kind of tug a little bit manually. That can relieve pressure off the cervical spine. Works tremendously well for headaches, works for neck tension, TMJ. It works for disc injuries. And it also relieves a lot of sinus pressure and ear pressure and lymphatic drainage. So it's very helpful. In the lower back, you might do it, pull both legs, or you might get at the pelvis and pull and anchor, and that could take pressure and the act of pulling and relieve some pressure too. That would be a manual. Now there's also similar where there's pulleys and there's more of a traction using devices where we could pump. There's the disc pump where you could set your neck, tie it, and you would pump air, and that would open up the spaces too. It's a form of pulling, very common in the neck and the lower back. There's newer things that are coming on, like the Y strap. It's very popular. You'll see it. The Y strap is an internet sensation. Is it safe? Should you use it? Like, those are the questions that I get asked in this clinic every day. Should we use the Y strap? I personally have never used the Y strap. That tugging, vicious pulling, to me, I wouldn't be comfortable with it. I've heard patients that have had success with it. I have heard patients that have had more pain with it. And it's the form of strapping your neck, grabbing and getting tension, and then yanking or pulling in the neck. Again, you'd want to be aware of things like sinus pressure. Are the joints stable to withstand a force like that? Previous history of car accidents would be important. So just be mindful of that before you're going into a therapy like a Y strap exercise. Other things for traction. There's mechanical traction. Mechanical traction would be set up similar. Now we're comparing traction to decompression, right? That's what we're talking about today. Mechanical traction is similar in that you're pulled. It's the act of being pulled. Set up on a table, harness around your low back or harness around your neck, and you're pulled. When that happens, you would maybe relieve pressure. The things you'd want to be mindful of is when you're pulled at a substantial rate and it's consistent, is that your brain is going to eventually tell your supporting muscles in the lower body or in the neck, and they would start to spasm. So you want to be aware of a spasm from a traction that's excess in force. That's the concern. And you want to be pulled, and you want to make sure that that is not too much force over too long of a period. You want to give your body a break. But that is a form of traction. So we've got manual traction. I left one out. There's also traction done with a towel where you could wrap you might see, we'll show some B-roll for the viewers. Geez, for the listeners, I apologize. You're going to get a towel, wrap it around your neck, and you're going to yank and pull a little bit, similar to a manual, but it's more of a harness. That could relieve pressure, but it's more of a yank or a pull. Can be held for a few seconds, may be beneficial. But again, similar to the Y strap, you want to be mindful that when you're getting that pull, that your joints are stable and your joints could withstand a boom, instant yank or pull with so much force that is not a controlled force. So just be mindful of that. Those are I would say, the most popular forms of traction. That's what traction is. It's the state of pulling. Again, been done for not only clinically for 74 years, there's research going back to the effectiveness of traction 74 years ago. And the research is mixed on traction. It shows, hey, there is relief on patients, but there's not enough research clinically of what I have seen where it says it definitely works. Now, I think traction is a good idea if it's done correctly. But from a research perspective, they want to know, well, how much weight are you pulling with? What symptom does the patient have? What scores or indexes are you looking for to see the improvement? That's how research works. Research, you need to have clinical groups, specific weights, specific pulls, specific time, so you can rate that versus a group that doesn't have the same exact treatment. That's how research is done. So the research is mixed. I haven't seen research that says it's harmful, but the research shows that, hey, it's beneficial. How beneficial? Hard to give a recommendation. I think it's a good idea to try it, personally, in 13 years of my clinical experience. Okay, that sums up traction. Now, what's decompression? How is it different? How is it similar? Spinal decompression, it's mechanical. So it's a machine that we use. Now, with traction, there's towel, there's Y strap, there's harnesses, there's pumps, and there's also machines. So they're similar in the fact that they both use machines for this technique. How does it differ? Spinal decompression, we strap you in the lower, but let's go to the lower back, for example. When we strap you in the harness, we can, with our specific dock tables, right? We can angle, again, for the viewers, I apologize, or I'm sorry, for the listeners, I apologize. For the viewers, check this out. We can angle this table to target your L4, L5, your L2, L3, whatever disc bulge, degenerative disc disease, stenosis, facet arthritis, whatever's going on, we can target that specific area. That would be done through a very thorough exam to see what would give you the most relief. And then we would do treatment in that specific area. That's a unique thing to decompression. Some traction tables may do that, but that's definitely a decompression trait. When we pull you, when the amount of weight is being pulled, let's say 50 pounds, it's not a sustained, this is huge, guys, this is huge. It's not just 50 pounds and you hang there for 2 minutes, or you hang there for 5 minutes, or you hang there for 20 minutes. It's not sustained pull, okay? It's called oscillation. And what it does is the table goes from 50 pounds and it oscillates from 50 to 25 and then 50. And you can set, the practitioner can set the guidelines of the oscillation. Well, you're thinking as you're on your walk, as you're listening, as you're watching this, well, how would the doctor know what oscillation period? That's where clinical experience is very handy. You want to find someone that's done this before. You can oscillate from 50 pounds to 25 pounds. You can oscillate from 50 to 40, 50 to 37. You can change that rate. You can hold it from 50 pounds for 30 seconds. That's kind of standard. You can also hold it for a minute. You can change how long does it hold and how much retraction is there. What is important, if you look at this image for the viewers, what's important when you pull, you see this? When you pull, that oscillation right there, that oscillation is that pumping effect. That is where the research shows that pumping effect will change the intradiscal pressure, the pressure between the joints. That's super important. That's going to allow that disc bulge to reabsorb. Again, let me repeat that for the importance of this. The oscillation in the pumping effect that's created is going to allow the reabsorption of this disc bulge or herniation or protrusion or extrusion or fragment. And it's going to allow it to reabsorb, and it's going to take pressure off of the spine and the exiting nerve root right there. If you've watched or listened to our podcast previously, you may be thinking, well, it doesn't work. Everyone says it doesn't work. Guys, we've shown pre and post MRIs that our decompression program has reabsorbed disc bulges from 98% to 50%. We've shown it. It works. Let's move on from that topic. So the oscillation is key. The targeting and the oscillation. The oscillation not only creates that pumping effect for the reabsorption of the bulge. If you get pulled for 50 pounds for 30 minutes, your back is going to freak out. You are going to get a huge muscle spasm, and you're not going to be very comfortable for a few days. That's where the oscillation gives your body a break. It allows those paraspinal muscles, the supporting muscles that support our spine, that stabilize the spine. We can pull it and we can relax them without exacerbating the spasm. So the oscillation prevents muscle spasm. If you've heard of someone getting injured from decompression, that would be because they either had instability and the doctor didn't know that. There are ways to know that. Or they were pulled too hard, too fast, and their body flared up. So you got to be mindful of how much weight you're pulling, the oscillation, the back and forth that's happening, and then also the weight that you're starting at. Depends on body weight, depends on the condition. How severe is it? Is it a disc bulge? Is it an extrusion? Is it a fragmentation? Is it dish? Is it stenosis? Is it degenerative disc disease? Is it facet arthritis? Is there a cyst? You understand where I'm going with this, right? You have to know what the heck's going on here. That oscillation is super key when we're talking about decompression versus traction. Prevents muscle spasm and it gets the pumping effect. Why during the consults that we have with patients, we ask them very specifically, what have you tried? Most of our patients have tried chiropractic, PT, acupuncture, injections, massage therapy, maybe even some traction. So as the practitioner, I want to know, okay, you got traction, totally get it. Was it manual traction or was it mechanical traction? Oh, okay, yeah, they got my neck and they used a towel and they kind of pulled a little bit and it felt a little better. It didn't last long though. Okay, but it felt better. Okay, great. It didn't last long because A, there probably wasn't enough mechanical force, and B, getting a towel will certainly not get that oscillation that we're looking for that will get the inflammation reabsorbed and the disc bulge taken off of the nerve. The oscillation is key. Let's say the patient had mechanical traction. Okay. And you have a disc bulge at L4, L5, and they did mechanical traction. Great. Let's say Susie got mechanical traction. How much weight did they pull you with? Most patients don't know. That's fine. I don't know. Okay. Let me ask you. Hey, were your legs in the air or were you laying flat? Like, what was the position of your body when they did the traction mechanically? Oh, I was just laying flat. My legs weren't tilted at all. There was no flexion of my spine. Okay. If it doesn't work, I know why it didn't work. The targeting of the specific joint where the disc bulge was, it wasn't targeted properly. That is probably why it didn't work. I can't say that for 100%, but we would do an exam and really only focus on, if I pull you with this much weight at this angle, is it going to work? That's how specific our spinal decompression program is. So it's important to know, if you're listening to this or you're watching and you've done traction, think to yourself right now, was it with a towel? Was it with someone's hands? Was it with a pumping device? Was it with a harness? Was it with a Y-strap? Was it with an inversion table? Did I hang from a pull-up bar? Was it mechanical traction? Were my legs in the air? Did the table go back and forth? Was my neck tilted? Or was my neck just laying flat? All these things are super important. You may get relief from that. If you got relief, that's awesome. Good. Most people I speak to don't get relief from those treatments. That's why we specialize in non-surgical spinal decompression to fix the problem. So, what are the three biggest things and differences about decompression and traction? Number one, targeting, very specific targeting. Number two, the oscillation, right? The oscillation, the pulling and the accordion-like movement. For the listeners, think about this. You can't see my hands. It's an accordion. It pulls and it goes in, and it pulls and it goes in. And that we can set and dictate how far out and how far in. How long does it hold? How long does it stay out? We dictate that. I dictate that. How do I know how to do that? I have done over 10,000 spinal decompression treatments. 10,000 spinal decompression treatments. That's how many. I've done well over 10,000. I have a very good idea. I know how long we should pull you for, how long should it hold, how long should it come back, and when it comes back, how long should it stay, how long should the treatment be, how many weeks do you need, what exercises should you do. Super important, extremely important to know that. And when we talk about decompression, it takes the pressure off. It's a pressure releasing, where the act of traction is simply pulling. We're pulling, and when we pull, it can take pressure off. It can happen. That's great. You don't need to call me. If you simply are pulling, you may not be taking pressure off. So what may take pressure off, if you've tried one of those forms of traction, what may take pressure off is when we pull and we oscillate and we accordion. The goal with the pulling for spinal decompression is to take pressure off. That's the goal, and that happens with the pumping effect. So again, they're similar, right? They're pulling, they're pressure, they're pulling. Sometimes it's mechanical, but they're also vastly different. And again, if you're listening to this and you've tried traction and it has not worked, think to yourself right now in your head, remember the chiropractor you're at, the physical therapist you're at, the doctor, remember where you were. What kind of pulling did they do with you? What kind of pulling was it? Guys, if they just got your neck and pulled behind the occiput and just tugged a little bit and it didn't work, that is not decompression. That's manual traction. That's pulling on the spine. It may work for you, but if you're still struggling with headaches, And if you're still struggling with nerve pain in your arm, or if you're still struggling with tension headaches, or you're still struggling with fogginess or fuzzy in the ears or pressure, if you're struggling with pressure in the ears and you've tried manual pulling, you need to do decompression. You need to look into decompression. And the same goes for the lower back. If you got one of those at-home pumping devices, those things could work great. Try it. If it works, keep doing it. If it doesn't work, or it's not working, or it only works for a little bit, it gives you a window. Guys, if something gives you a small window of relief, that's a good sign. You either need to do it more often, more of it, or you need to find something that's more professional about what you're doing. So if you're pumping and it's helping, but you still have sciatica, or you still wake up every day when you sneeze and your back hurts, or you stretch every day and it still hurts, or you can't put your socks and your shoes on and your disc pain still hurts, you got to look at a non-surgical spinal decompression. It just works. Does it work 100% of the time? I'm here to tell you it does not work 100% of the time. It works a lot, though. And we help a lot of patients. I hope this was insightful for you if you're dealing with neck or back or some kind of issue related to the spine that, I want you to know where to go. I want you to know what should you try, where should you go to next? If you haven't done this, why should you try it? If something didn't work for you, would it work for someone else? So I really want you to grasp the concept of what the heck should I do next? That's why I want you to listen. So that wraps up episode 15. Hopefully I summarized the difference between traction and decompression. Traction and decompression. And I gave you some insight on maybe the next step if you're suffering on what you could do. So I want to thank you for watching and thank you for listening. Thank you again to our sponsors for PillowWiseUSA.com and PowerPlate USA. I look forward. Don't forget to download us on iTunes or watch on our YouTube channel, Dr. Dudum. And episode 16, I'm excited. We have a guest. Episode 16, a patient is going to sit with me in our new season 2 studio, and we're going to discuss their progress from A to Z so you can learn about what we do here at my office. Thank you for watching and listening. We'll see you next time.